educator in me really has appreciated just how creative CHEST has been as an organization. I'll get a little geeky here for a minute in terms of learning theory. Yeah, I know.
You get geeky? I can't envision. Okay, let's take that down. Maybe I could see that happening.
Yeah,
right, so let's do it.
So I mean, how do adults learn, right? So first of all, as an adult, I'm going to learn something because I have a need, right? I want to learn it because it's confusing to me. I need to know it for my job. I want to take better care of my patients. And so I'm going to look for some sort of resource that's going to take me where I need to go so that I can be a better doctor, take better care of patients, right? The next part is, how do you deliver that information? Well, sitting in the back of an auditorium 1,000 miles away from the podium while somebody drones on a screen, I'd much rather sit at home in my fuzzy slippers, watching that on my iPad. What I really like about CHEST, and you and I have been involved in this now for over 15 years, has been the tremendous diversity of educational offerings that this organization has developed with a ton of effort and thought, all with a learner in mind. We started off with simulation. Gosh, it was 2006 or 2007. We had a bed in the middle of what we then called the exhibit hall where people came by and practiced intubation, right? That was the very first simulation activity we did at CHEST. And then all of a sudden the next year we had like a whole room. And now we build a 29,000 square foot simulation center every year in the convention center and provide, literally 5 days worth of hands-on simulation activities in all sorts of different areas that people can experience. The intimate one-on-one conversations that brought me into CHEST to begin with world-class faculty turned into small case-based interactive discussions, right? We piloted that in Atlanta in 2012, no more than 30 people with no more than 3 faculty members, talking about different cases, clinical challenges, the stuff that we struggle with every day put in a clinical context, answering the questions that you just can't get out of a textbook, or easily through a literature search or up to date. You combine that with the interdisciplinary sessions that we put together when I was chair. It's sort of nobody practices in a vacuum as an individual anymore. So how do you blend the multidisciplinary perspective that comes with, a tumor board or a multi-specialty interstitial lung disease session or interstitial lung disease discussion? And then the other part that I think I've been really excited with over the course of the last 5 years has been looking at introducing other members of our interprofessional team. So you look at the Critical Skills for Critical Care course, which is our first simulation course dedicated to advanced practice providers. And what's so cool about that course is, since we're known for physician education, there's still a lot of physicians that come to that course. And so now you've got nurse practitioners, PAs, and physicians working in a high fidelity simulation environment, just like real life, and you know what? It's just pure magic.